Good morning, everyone. We'll just be kicking off in a second, so please come join us. If you want to send message in the chat and say just where you're coming from today and your profession, that would be awesome. Okay, so we have lots to discuss. I'm going to get us started today. So welcome everyone. My name is Sarah Gill and I'm your moderator for today. I am a member of Health Promotion Ontario's Professional Development Subcommittee, and we are also thrilled to have you join us today for Health Promotion Ontario's 2023 webinar series. The webinar series this year is Health Promotion in a New Era, Skills We Need for a Changing World. Now, today we're going to kick off our first session, which is knowledge translation, turning data into a story. We're very happy to have our speakers with us today, but I do want to start with a land acknowledgement before we start the webinar. So I am joining you today from the traditional lands of Nguojuanong or Peterborough, Ontario, and I respectfully acknowledge that I am on Treaty 20 and traditional territory of the Mississauga and Anishinaabe. We offer gratitude to the First Nations for their care, their teachings about our earth and relations, and may we honor those teachings. So this session today was made possible by our Professional Development Subcommittee. You can see our names down there, the Ontario Public Health Association, and of course, Health Promotion Ontario. And as the voice of health promotion across the province, HPO seeks to advance the importance of health promotion through professional development, member communication, and advocacy. And we are hoping that you'll join us as a member of the Health Promotion Ontario. So a few housekeeping notes just before we get started. The session is being recorded and will be made available online, and everyone who is registered will also be able to get the recording after the session. We encourage you to ask any questions that you're hoping to have our participant or our panelists answer in the Q&A section. If you want to chat in the chat box and have a little bit of a discussion, please go ahead, but anything you're hoping our panelists can answer should be put in the Q&A, and we'll pull from those towards the end of the session. Our session today is broken down into 3 sections. At first, we will have our speaker presentations, and then we'll go to a panelist discussion. From there, we'll end with a Q&A. So very happy to share our panelists today. We're going to start with a presentation from Sabina Borja Miller. She has an MSc in clinical pharmacology and toxicology and is currently a doctor of public health student at the Dalla Lana School of Public Health. Sabina is the founder of Unambiguous Science, an educational platform that aims to make science approachable, and the co-founder of the South Asian Health Network, a volunteer-based organization focused on culturally appropriate health education content and advocacy. Sabina's passion includes science education, especially countering vaccine misinformation, as well as promoting and advocating for health equity and access to healthcare. As a first-generation immigrant, she believes strongly in community-based approaches and to help build a more resilient and equitable Canada. So thank you so much, Sabina. Second, we're going to hear from Raiha Heavens. Raya is a social worker, her work is based in social work since 2013. In the 8 years that she has spent with the Métis Nation of Ontario, she's had the opportunity to work in a variety of positions. Through this, she's found a passion for macro social work in a variety of positions. She's working on branch or nationwide initiatives. Raya has worked on several health promotion projects, such as the MNO vaccine campaign, branch-wide education and training, and promotion and education short films. So thank you so much for joining us, Raya. And finally, we're going to hear from Peter Snow. Peter is a knowledge broker with the Canadian Coalition for Seniors Mental Health, and Peter started in social services, nonprofit, and then healthcare before moving into knowledge mobilization. Peter is inspired by people and their infinite capacity to solve problems and be creative. Working with CCSMH is a nice combination of his passion for writing and creating and knowledge of healthcare and the social systems. So thank you all three for joining us, and we're going to start with Sabina's presentation.
Hello, my name is Sabina Vohar-Miller, and I'm the founder of Unambiguous Science and the co-founder of the South Asian Health Network. I'm here to talk to you today about building trust and countering misinformation on social media. I've actually been countering vaccine mis and disinformation on social media for several years now. In fact, it started when I joined mom groups on Facebook and realized there was a serious avalanche of mis and disinformation, and began countering some of that in my spare time while I was on maternity leave. What I'd like to talk to you today really is about, understanding where people are and how to actually meet people where they are. So, in terms of my platforms, I have a standalone website. I'm also on Twitter, I'm on Instagram, and I'm on Facebook. I've not yet managed to figure out TikTok, so that's one of the avenues that I'm not on, platforms that I'm not on, but there's a reason, in fact, why I've diversified my reach. 2/3 of adults from 40 countries are internet users. 85% of US adults say they go online on a daily basis, and 75% use social media platforms. With teens and those who are under age 30, TikTok and Instagram are the most visited sites. Whereas with older adults, over the ages of 30, it's YouTube and Facebook. So if you're looking to meet people where they are, they're on the internet. And of course, this is not taking away from the fact that we should, in fact, do everything we can to make information accessible to everyone, including those who are not on the internet. But that's a conversation for another day. Now, what I really wanted to start with was talking about why I do this work. I think, a huge reason as to why I started Unambiguous Science has to do with the fact that these platforms reach a lot of people, and more so than I can do than from that one-on-one interaction that I used to do quite a bit in my early days. And so while I still continue to do a lot of the one-on-one interactions, I realized that having a platform such as Unambiguous Science or just being on social media, in fact, I'm able to reach a lot more people than I typically would with these one-on-one conversations. So as an example, I remember, in the early days of the vaccine rollout here in Ontario, there was a lot of distrust with respect to Moderna. People were not really wanting to take Moderna. They were holding out and waiting for Pfizer. However, we had a Pfizer shortage. And I created this post really just talking about Moderna versus Pfizer. I talked a little about the pharmacology behind it, a little bit about the immunology. And again, this was at a time when Delta was hitting us hard, and we really wanted to make sure that people were going in and getting their dosage of the vaccine. And this post, reached over 1 million people. And there's absolutely no way I could have actually talked to 1 million people on a one-on-one basis. And so there is a huge, huge impact in terms of the number of people you're able to reach through social media platforms. And, a part of me, when I started to develop this presentation, I was going to originally make it a lot more academic, talk about why we need to be using different platforms, especially social media platforms, to try and promote health and health information. And I think what it really came down to me is I think there is a bit of a black hole in terms of implementation and some of the practical advice. So what I'm trying to do over the next few slides is actually take you through some of those practical applications of what has worked in my efforts using social media to promote vaccines and promote health, and what really has not worked. So one of the things that I find social media is fantastic is actually to build trust and relationships. And I know this sounds a little, it doesn't sound very, very intuitive, but I think there is something to be said about information coming from someone who is a person, their name, what they look like, versus information coming top down from a health agency where you don't really know anyone, you don't really know the processes. you don't really understand, complex healthcare systems. And then the other advantage of having a platform on social media is you're able to actually build on some of these relationships, have open judgment-free dialogues, have those connections, and you feel very much like you're in this together. The number of times I've had people reach out to me and ask me, for advice on personal situations in terms of COVID, how to manage, COVID, how to access the vaccine because they're in an area where they did not have easy availability of vaccines. All of this, was because of the fact that they knew there was a person behind the account. And in this slide, I have a post, an on Huffington Post by someone who was an anti-vaxxer and ultimately ended up changing their mind. And some of the reasons that they talked about is that they wanted someone who they could just speak to about their fears, about their concerns, and have that judgment-free dialogue. And one of my proudest moments was reading this article and seeing my name listed over there as one of the Instagram accounts that really helped them, educate them, and help them change their mind. The other advantage that you have when you're on social media is that you can be nimble and you can be agile and you can change your formats, your medium, your styles. And I did that throughout, COVID pandemic. There were certain topics and certain times during COVID when people were really longing for detailed information. So this post, for instance, it was on the safety of the COVID-19 vaccine in pregnancy. You can see there are 10 slides, on this post that I made. They're very data intense. They're very data heavy. They talk about all of the different analyses and studies that exist. They go into depth of this information. But then there were actually times during COVID where I felt people just had too much information and they were having a harder time processing all of this very data intensive information. And so I tested different techniques. I had a speed response series where it would be just one slide, no intense data, just, question and answer style, just to get people, at a phase where they did not necessarily want a lot more information. They could have these little, small, easily digestible tidbits as well. I also tried different things with respect to graphics to see what was catching, what caught people's eyes, and posts that were really quick, easy learn. You look at it 10 seconds, you take something with you, and that remains with you for the rest of the period. And so these were the posts that I really just wanted to have a very quick impact, very immediate and very quick impact. And then you can also be nimble in the sense that you can be timely. You can react quickly to information that is coming out. You can make these posts so that your information, your credible, right information is the one that's actually hitting people first. So for instance, the first RSV vaccine was just approved. Within the day, I had a post talking about the RSV vaccine, why it's so important and what the data looks like and what the next steps are. Similar, when the pediatric vaccines were approved in Canada, it's really important sometimes to be the first person before you get mis and disinformation hitting you from other sources. It also is an opportunity for incredible partnerships. I have posts that I've actually made with immunologists, with allergists, with ID physicians, and where we can sort of combine and bridge our joint expertises and bring a topic that is otherwise not as accessible to the general public. And then you also have the opportunity of turning some of your social media posts into actual academic publications. The post I did on Novavax, in fact, ended up being a publication in CMAJ a couple months later. But what's really, really key and really important when you are using social media is you have to make sure that you're nuanced and you're credible. So don't fall for that sensational, clickbaity type of media that I think, we're seeing a lot of these days. It pays to be nuanced. You build trust with people when you do that. And also make sure you're checking every source, every references, including all of your citations. As an example here, I have a post where it shows all the references I used to make that post so people can refer back to it. The post that I have on COVID-19 vaccines and menstrual cycles actually was one of my very, very early on, posts before we actually had data showing that, there can be some small minor changes to the menstrual cycle because of COVID-19 vaccines, because it is theoretically plausible. We've seen it with other vaccines as well, and there's a physiologic rationale behind it. And so when I had people talking about menstrual cycle changes, I made this post to say, well, we don't really know what exactly is going on. So we don't know if there's a causation or association, but here are some of the things that, could make it theoretically plausible. And then when you had data come out later that showed that there was a slight difference, but again, no difference in fertility, people came back to me and said, thank you for being one of the people who actually talked about it in a nuanced way, as opposed to just saying, nope, there's no chance of the vaccine causing this. So I'm going to leave you with some of my SciComm tips. I think what's really, really important is to be accurate, be up to date, be nuanced, and be credible. You want to make sure that you are hitting all 4 of those quadrants when you are using social media for health promotion. Some other tips from, just from my own experience, from what I've seen other people do. First of all, don't amplify the myth, especially in the heading. Remember that sometimes people just look at a post for 20 seconds. You don't want them to take with them the misinformation or the myth that is, sitting on your headline. You want to make sure you're debunking the myth from the very get-go. You want to break down statistics to numbers that people can easily relate to. Do not blame or shame or insult. You can never change behavior using these techniques. Limit the use of jargon, limit the use of complicated terminology. Understand that you lose people when you talk in too much jargon. Again, be nuanced, avoid sensational narratives, always go to the source and verify, ensure that the information is credible, cite references, and to be inclusive, always try and use alt text and other tools to make sure that your posts are accessible to everyone. And that's it. If you need to contact me, I'm on Twitter, I'm on Instagram as Unambiguous Science, on Twitter as SabbyVM, and those are some of the websites that I am part of. And so feel free to reach out if there's anything you'd like to discuss further.
Thank you so much, Sabina. So we're moving on to Raya Heavens, who will chat a little bit about her work.
Knowledge translation and storytelling through film. Hello, my name is Raya Heavens. I am the team lead of chronic illness for the Healing and Wellness branch of the Métis Nation of Ontario. I've been with the MNO for 8 years, and in this time have had the opportunity to partake in many health promotion works and projects. I am excited to speak to you all today regarding health promotion and how its goals and philosophy can be utilized in knowledge translation and storytelling. I'm going to focus on one medium for the discussion today that the team and I have found particularly successful: film. While we also share information to create discussion points with our clients through other means such as congregate meals, crafting circles, virtual presentations, individual services, and more, we have noted particular success in bringing people's voices forward through meaningful, targeted videos. Our team has worked to spread awareness, education, and share stories through film for about a decade. We have covered a variety of topics through group discussion, activities, and individual interviews. Over this time, we have facilitated the creation and distribution of a variety of short films, 2 of which I will be speaking to today. Our Brother's Voyage. Our Brother's Voyage was a combination of knowledge translation and story sharing. We had a group of men and program facilitators from our team discuss the importance of treating women, their families, and community in the spirit and respect of the 7 grandfather teachings. We discussed what the 7 grandfather teachings were practically, used activities and discussion to gain comfort with the concept and its applications, and used fables and meaningful quotes for personal reflection. The participating men also shared their own stories, how they felt regarding communication, how generations impact each other, and how connecting with the land and each other is crucial. The final product was a video of about 13 minutes in length. Our Brothers Voyage was also created as a progressive activity that can be held in any area using the booklet of information, descriptions, activities, fables, and quotes seen in the film. The candid nature of this film provides an outlet for men to feel comfortable opening up to challenging experiences, which in our experience, often takes longer to achieve in person. This video is an impactful starting point to let men know it's okay to be vulnerable, and that there is strength in helping others share a healthy vision when addressing uncomfortable discussions with their peers. The Champions of Change project was the creation of 4 short videos of about 3 to 5 minutes each. 3 of these videos focused on storytelling. We had 2 videos of personal cancer journeys and 1 video of the journey of tobacco cessation. The 4th video was based in knowledge translation, created in partnership with Ontario Health, and discussed the importance of cancer screening and how to access it. We have noted that it can be particularly challenging to help families begin to acknowledge and address the impact that cancer has in their lives. The opportunity to hear a variety of knowledge through specific lenses has created a space to start discussions that may not have otherwise occurred. We use knowledge translation and storytelling as the means of communication and sharing the desired message. The medium of video has allowed us to relay very personal and culturally resonant stories and information to Métis people across the province in a safe and accessible way. With knowledge translation, we focused on building understanding, education, and capacity. We work to make larger or complex information and concepts graspable. We changed our language, images, and context towards a specific cohort so that it spoke directly to them. For storytelling, we wanted it to have a personal touch. We worked with our participants to share aspects of their experiences that would resonate with the target audience. We used imagery, B-roll, music, and personal infliction and emotion to make an impact and share the importance of the message being conveyed. Being a part of a project such as these can be tremendously fulfilling. They allow for expansive creativity, connecting with a multitude of people, and for your passion of the topic, message, and goals to be reflected in the final product. Although these videos were all made through the Healing and Wellness branch of the Métis Nation of Ontario, they were all on different topics with different cohorts and showcased different participants. While we try to incorporate a variety of options, we have noted that human-level sharing continues to be the most effective. With this in mind, we now have a growing library of tools across multiple media, which can be selected based on goals and target audience. Our growing inventory of video tools has been a critical catalyst in opting for more than the standard pamphlets and reliance on clinical models. Creating films and videos such as these can take months to even a year per project. You need to have a vision and a solid understanding of your cohort, lens, and overarching goals. There are several planning, actioning, and finishing steps that are required. Participant recruitment can also be difficult. As the timeline can be lengthy, there can be ongoing turnover in participants. You also need to find participants that fit within the context and have commonalities with the cohorts you are looking to connect with. Participants need to be willing to share, be on camera, and have their personal thoughts and experiences distributed publicly. Having all of these come together can be difficult and often requires a pre-existing connection to the cohort's community. Using film as a medium for knowledge translation and storytelling has been highly effective. The final product can be shared over a multitude of platforms, internal and external to the organization. For the Métis Nation of Ontario, this means having it accessible through our internal server system and sharing it publicly on YouTube. It also means it can be shown at meetings and events where we are working to spread the message and want to make an impact. We have learned to utilize health promotion for storytelling to create a common mindset for various issues and find ways for a variety of voices to a variety of solutions that include prevention, mitigation, and resolutions for challenges faced by our communities. We have learned to utilize knowledge translation to share information, provide education, and/or build capacity that is adjusted and directed to the specific cohort we are trying to support. It is important to take the time to break down information in a language that matches the lens you are working with. When communicating with a specific cohort audience, you need to speak their language while still providing knowledge and learning opportunities. By doing this, we work to find the best way to connect different people to information. Health promotion is not a discipline. It is a mindset when processing information, situations, and possible outcomes. It is equally a commitment to go against a one-size-fits-all approach and to look at the large and small implications and determinants. In regards to story sharing, we need to build space for openness, honesty, and safety, allowing those who have knowledge and wisdom to pass down their thoughts and experiences, whereas it equally allows those with questions, concerns, and needs to share their own experiences, learn, and have the safety to ask for assistance. Knowledge translation is when we use these stories, these different community voices, to find ways to help, educate, and bring people together in their shared commonalities. We make regular effort to ensure that information is available through a variety of media and lenses so that those who need it are able to readily connect and take action. Overall, the goal is to increase comfort levels of our communities to use stories and to make connections. When we recognize that health promotion is and apply its mindset to storytelling and knowledge translation, we agree to a responsibility to actively listen and share and be innovative, and to look to the individual as well as the larger determinants. We consider the person as a whole complex being and do our best to support their journey in a holistic and compassionate way. We recognize that their story is a gift, and we work to educate and inform through care rather than through command. Our inventory of video tools has been invaluable in allowing difficult discussion not just to occur in the first place, but to occur in ways that are most appropriate to the values and heritage of each individual client who asks for help. Thank you.
Thank you so much, Raya, for sharing today. We're going to move on to our final presentation from Peter Snow.
Hi, I'm Peter Snow, and I use he, him pronouns, and I'm a knowledge broker with the Canadian Coalition for Seniors Mental Health. We are a Canada-wide partnership of major organizations working in older adult mental health. For over 20 years, we've been creating and sharing practice guidelines, public information resources, and other materials to clinicians, older adults, caregivers, and the public. Recently, we have received significant funding from the Public Health Agency of Canada to pursue knowledge mobilization in 4 key areas of older adult mental health. We see ourselves operating for around 5 different audiences. We want to help clinicians do their work more effectively. We want to inform the public. We want to give health providers resources they can provide to patients. We want to give people actions they can take while they wait for clinical treatments. We want to inform clinicians about ways to communicate more effectively with their patients. It's a lot, and as I'll explain, we've been streamlining our approach so that we can be consistent across our key areas and audiences while being thoughtful of their individual needs. In the past, our primary focus has been on printed materials. So we've produced some popular clinical guidelines and clinical reference cards. In 2018, through a partnership with Shoppers Drug Mart, we distributed a depression in older adults information pamphlet in pharmacies across the country. We have recently revised that pamphlet, and I'll be discussing the process later in my presentation. We focused on print for several reasons. Printed materials provide a tangible item that someone can take away with them. There's the possibility that they will interact with the pamphlet or sheet more than once if they put it on their fridge or leave it on a table. This repeat interaction increases the opportunity to connect with the material and act on it. Of course, we live in a digital world. We also create materials for social media, web, video, and other media. And we're taking advantage of QR codes and web analytics to track the reach of our materials. We're also building partnerships with groups that could use our information. Let's talk about some of the principles that guide our knowledge mobilization work at CCSMH. To do that, I'm going to talk about our ongoing Depression Guidelines Dissemination project. In 2021, a group of experts revised our depression clinical guidelines to include the latest research. As part of our PHAC grant, we're sharing that research with several different groups: clinicians, physicians, older adults, caregivers, and the public. I've been the lead knowledge broker on the project and have created several different materials and assets to support our efforts. We have a depression pamphlet, accompanying information sheet, and a video aimed at older adults and their caregivers. We've made screensavers and printable cards for clinicians. We're creating materials for all those audiences about the stepped care approach, which is highlighted in the guidelines. We expect to be launching the whole package in June for Seniors Week as part of a coordinated media effort. So let's talk through our approach to taking this dense scientific and clinical document and making the information accessible and relevant to older adults and their caregivers. We almost always start by identifying our audience as a whole and the specific subgroups of the larger sample. By knowing who we're talking to, we can create materials that relate to them and can initiate a conversation about whatever issue we are discussing. We need to know who they are and what they need to know. When we're revising the depression pamphlet, for example, there was a temptation to include a lot of additional information about new treatments. Since we knew our audience was older adults and their loved ones who might be experiencing some of the symptoms of depression, we knew we should include some treatment information. We also knew that our audience would likely not know they had depression or not be sure, and it was more important for them to connect their experiences with the symptoms and to know what the next steps might be. So by knowing who our audience is, we can set clear goals for our materials. The pamphlet isn't intended to be a comprehensive description of depression. Instead, we want people to recognize their experience in how we present depression. Now, we open the pamphlet and the accompanying video with this statement: are you feeling sad and lonely as you age? You don't have to. We don't expect that our audience knows anything specific about depression, but they are experts in their own experience. By asking a question, we're inviting them to reflect and also to recognize a connection. This approach has the added benefit of challenging the idea that being miserable and isolated is inevitable as you age. Our overall goal is for people who are experiencing symptoms of depression to take action and talk to a health professional so they can have an improved quality of life. Once we've identified our audience and established our goals, we can understand what we want our audience to do with that information. We start to focus on actionable steps. We always want to give people something they can do in response to our message. Going back to our depression information project, we included a lot of concrete steps that people could take. For example, our pamphlet and video highlight the social and lifestyle changes that can help with mood, in addition to the more clinical steps you might take. We also provide a checklist of symptoms and tips for how to talk to a health professional about your feelings. We want to make it as simple as possible for people to act on the information that we've provided. Now, the last thing I want to mention is creating multiple paths to information. As I mentioned, CCSMH has historically created print materials aimed at clinical audiences. Our evolution is taking the print foundation and building a web of materials around it. We recognize that the more ways someone can interact with our message, the more likely they are to hear it and absorb the information. And this doesn't have to be complicated. We created our messaging for the pamphlet which gave us the pieces to build other materials. So the tagline becomes part of a one-page screensaver or a poster. The basic information can be put in short text and made into an image video that can run on a waiting room TV. We took certain parts of the pamphlet and created a 2-page printable sheet for someone who's been newly diagnosed. The clinical guidelines recommend step care as the standard treatment approach. We created information for family physicians and health professionals about step care. We aren't trying to explain the entire concept. Rather, we understand that this audience might have some knowledge of step care and just needs a reminder. For the general public, we're creating a 2-page information sheet that helps them understand step care and why it might be helpful. Let me review what I just discussed. So, taking clinical guidelines or treatment recommendations and translating them to a general audience requires understanding who the audience is. It would be great if everyone knew about depression, but for our purposes, we're speaking to older adults who are experiencing symptoms and may not even realize there's an underlying issue. And once we have that audience in mind, we can think about their needs and establish our dissemination goals, ones that speak to them. In this case, we created tools and assets that made them think, wow, is this me? And then we gave them actions they can take right now. We gave them tips on how to talk to a doctor or other health professional. We gave them actions they could take on their own to start to feel better. And lastly, we try to use multiple methods to deliver our message, which we hope will help increase interaction and hopefully lead to people taking action. Translating complicated clinical information to a general audience is really important. And by focusing on what your audience needs to know, it can simplify the process. If you can, spend time understanding how they will use the information, relate your message to their lived experience, give them practical actions to take, and make sure they have as many opportunities as possible to see your core message. Thank you for your time.
Thank you so much, Peter, and thank you to all 3 of our panelists. Now I'm going to ask our panelists to please pop on their video so that we can start our discussion. And this is just an opportunity for our panelists to have a conversation about their work and get a little bit more in depth about how they sort of use knowledge translation in their work. So the first question I have is, First question I have is, what are some of the strategies for converting research findings and scientific jargon into messaging that can be easily understood by the general public? This is a conversation that we can have, so whoever wants to start, please jump in.
I can go first. I think I would probably go through some of the checklists that I had on my presentation with respect to things that people can do to ensure that they're giving the right information out to the general public. I think for me, the 4 things that I keep in mind every time I create a social media post really is to make sure you're accurate, make sure that you're up to date on your information, make sure you're nuanced, and make sure you're credible. And I think after that, I think also just have some fun, because it's really nice. It's really, one of the advantages you have when you're using these different platforms for health promotion is that you can try out different things and see what sticks and see what doesn't. So have some fun with it. And I think that's, as long as you have the 4 key things in the back of your mind, try different things and see what works. As you can see, there's so many different, the speakers today with Raya and Peter talking about their modes of, information translation. I think you can see that there's so many different ways of doing this. And so try out different techniques.
So I can go next. I would say that you really need to think about your audience and sort of the comprehensive language that would be graspable to them. I think you need to consider
the format in which you're sharing that message. So for example, whether it be social media, whether it be a document, a video, whether it's digital or paper, and what is likely to reach them in their communities. And I think you also need to be receptive to any feedback that comes your way so that you can make adjustments to how you're presenting the information. I think that you need to keep a cultural lens as the baseline and do literature reviews, talk to people, figure out what's similar and what's different. And then it's been recommended to me, and this is kind of a mentality that I have when I'm doing this work, is coming with a mindset of what is in it for them and how do we prevent what's in it for us from becoming eroded or overshadowed.
Thank you, Raya. And Peter, you mentioned in your presentation that you work with a variety of audiences, so clinicians, as well as like general public or older adults in your case. How do you move from some really technical language to something that's very sort of base level for that older adult audience?
Yeah, that's it can sometimes be a real challenge because, you know, sometimes the way that clinicians talk about things doesn't make any sense to the general public, or they don't have the framework to really make sense of it. One thing I think is helpful, just as a broad strategy, is the use of metaphors, right? So using things that people do understand and connecting them and relaying them. I think it's important too to sort of orient yourself, right? When you're trying to convey, you know, technical information to a general audience, you're not necessarily trying to make sure they understand everything or that they understand it to a specific level of detail that you might if you were doing to a clinical audience. So for example, when we're working with our guidelines that we create, you know, when we're presenting that to clinicians, yeah, of course, we want them to understand, you know, the technicalities of it because that's relevant to what they're doing. But for a general audience, they don't necessarily need to know that. So we try to figure out what is they actually need to know. And I think it's kind of what Raya was saying, like what is relevant to them? What's meaningful to them? What part of this is actually going to be important? And, you know, especially knowing that for most people, we're only going to get a very small amount of their attention, you know, no matter what format we're using, you know, we have a limited window to actually, so we want to make sure that the thing we want to say is the thing that stands out, you know? So one interesting kind of example of that is, you know, in a lot of the work that we're doing now, we're really emphasizing hope and hopefulness and, you know, sort of getting away from the disease pathology idea and more into the like, hey, like, you know, things can get better and there are opportunities. And that's actually a much more relevant message to people, right? Because if I'm not feeling well, I don't need someone to tell me that I'm not feeling well. What I need is someone to tell me like, hey, what can I do about it? You know, and how do I relate myself to this, to the situation? So I think plain language obviously being really important, and metaphors and ways that we can kind of express like, okay, I don't need to know like why depression happens. Like I don't have to understand the biological components of depression. I just need to know that, hey, I'm having these, I feel this way, or I'm experiencing this, and this is what it might be, and this is what I should do to figure it out or to do something about it. So I think, you know, getting down to what's important, which is kind of just echoing what I was saying is, you know, that I think that's really, really central to that process.
Excellent. Well, thank you so much. I'm going to move on to our next question. So how important is building trust with your audience in your role or organization? And what is one of the strategies that you could use to build trust?
I'm happy to go first for this. So I would say that trust is critical. Trust is the bridge to being receptive to the message. So change requires buy-in if it's going to occur, let alone last over time. Ways that we can build that trust is to keep our word, be honest about our intentions and goals when we're sharing the information, and lead from whatever cultural base applies in all of our collaborations.
Yeah, can add on to that. I think that point of like being open with people is so important, right? There is sometimes a tendency, especially in, I think in medicine, to like keep information, like doctors, clinicians, whoever want to hold on to information they don't want to share. This actually came up when we were doing our depression stuff because some of the treatments for depression include hospitalization, ECT, electroconvulsive therapy, and a lot of healthcare workers are reluctant to raise those ideas with people. One, because they're, they have stigma attached to them, but also because, they're not for everybody, right? They're only for certain groups of people that are actually relevant. But the idea that we're going to keep information from people sows mistrust, right? Because when people do find out about things that we haven't told them about, and I think actually, Sabina, when you were talking about the effects of vaccines on the menstrual cycle, I think that was such a good point that you made, that like you didn't try to pretend it wasn't a problem, or you didn't try, like you weren't defensive about it. You were honest and you said, could be. And I think that's such a huge thing, because people are going to know later on, even if they don't realize it when you're telling them, later on, they might figure it out and be like, oh, why did that person lie to me? Or why did they like hide this from me? And that creates so much mistrust. And then why are they going to believe you the next time you say something?
I wouldn't mind adding on as well to that. I completely agree with both Raya and Peter. I think that, being credible from the very get-go on everything you talk about is really important. Being honest and transparent, again, is incredibly important. It's really, really easy to lose trust, and it is so much harder to build it back. So you want to get to a point where you're never in a position where you're losing someone's trust. I think the two things that stand out for me in this, when I talk about credibility, there have been other science communicators, healthcare providers, including physicians who sort of haven't been fully upfront or truthful about, who they are, what their conflicts of interest are. I think in my opinion, always be transparent about that. You don't want to ever be in a position where someone is questioning, what your conflicts are, whether you have any other interests in mind. And then the second thing also is I think people have a hard time with uncertainty. And I think that we don't do a good job of explaining uncertainty. I think everyone wants, things that are 100% certain, and that's simply in science not possible, right? The only certainty in science is that there is no uncertainty, and that policy is always sort of playing catch up with science, right? And so I think for a lot of people, it looks like we're flip-flopping, in the early days of the COVID pandemic, for instance, many, public health units came out and said, do not wear a mask. Instead, I think that our message should have been a little more nuanced, in that we don't really have information about whether masks are protective or helpful at this point. If you want to wear a mask, go right ahead, but we ask that you don't use the medical grade masks that are really necessary and important for the medical community right now, right? And I think that we sort of missed the boat on building some of that trust from the very get-go on some of these topics. So, I think that we need to do a better job of building that uncertainty into our responses. And when we do, and we're upfront about it, I think over time we build trust.
Fantastic. Thank you all so much. I'm going to move on to our third question. How would you suggest creating knowledge translation materials for subjects that are unfamiliar to your target audience or potentially controversial to your target audience?
I'll take this one first. Be very careful and thoughtful, I think, is number one. Actually think about what you're doing. There was a really great example of this recently, actually, not to call out another organization, but you may have heard of the safe drinking guidelines that came out a few months ago, and there was a big uproar about it. And I think we've actually talked a lot about it at our agency because we're not super well known in a lot of circles, and we're putting stuff out into the public, and we're sort of being very mindful of like, how are people going to interpret what we're saying because they don't know us, right? We're not a known source of information, and we're not, someone who can necessarily say something. And in some of the areas we're talking about can be controversial and can certainly be hot, very emotionally charged topics. So I think just being very, very aware of like, okay, if I'm going to say something, thinking through those next three steps, okay, what is the reaction to that going to be? By the different groups of people, the people that maybe know me, but maybe the people that don't know me or don't know what I'm talking about, how are they going to react? And then how am I going to react to their reaction, right? What's my plan? What's my strategy? If someone comes back at me like this, what am I going to do to sort of, try to rebuild trust or whatever it is I need to do? I think a lot of it does come down to that idea of being thoughtful and planning, and then doing, as we've all been saying, like making sure that you're backing up what you're saying, right? Making sure that you're very clear why you're saying what you're saying, and you're not being stubborn about it. You're being, honest. So I think there is a big difference between, and we saw this in COVID a lot, right? The difference between being stubborn and being honest is really important.
couple of things that I'd love to add to that. I think that, I guess there's two questions here on things that are unfamiliar and then things that are controversial, right? I think on the controversial aspect, again, I could think over here, one of my posts that I showed an example is that more than one thing can be true at one time, right? And I think that we need to sort of take that into account. Like, I mean, another example would be schools and COVID, right? And I think that was such a huge topic for a very long time. But it was not a black and white topic. There was so much to it, right? And so I think that anyone taking a stance that was very just myopic in their view and not actually looking at the full picture was, I don't think they were doing a great job of actually communicating to the public when they took this myopic view. So I think that understanding from the get-go when it's a controversial topic that there are many things that could be true at one time, and talking about all of that in a nuanced way, I think is really important. And then on the part that is unfamiliar, I think for me, what I love doing is building foundations of science literacy from the ground up. And so, I mean, I think throughout COVID, I think I probably gave over 60 to 70 vaccine education sessions to the community. And I never started with the mRNA vaccines or for COVID. I always started at, let's talk about your immune system, right? And what are the layers of your immune system and why are we actually using vaccines, right? And I think that really helped solidify the reasons why we were, especially I felt, I was doing a lot of this work in the South Asian community, and I think the South Asian community especially had a lot of distress, especially in the early days, given that they were very hard hit. They felt like not enough was being done to protect them with, a lot with the precarious employment and some of the unsafe working conditions as well throughout COVID. And then here we are telling them, actually, you're prioritized for vaccines, go get it now, right? And there was a disconnect there. And so how do we actually get people to trust the vaccines? I think it really helped starting from the bottom up and talking about why vaccines are so important and what the immune system does. And actually speaking on this topic and really going back to your question on trust, another thing that triggered my mind is that there are times when I would give a 2-hour session on this entire big topic of vaccines and immune systems and all of that. And then the question I would get in the Q&A period would be, have you been vaccinated? That's all they wanted to know, right? And it was really, really interesting because I then shared on social media a picture of my dad and I. My dad is immunocompromised. Dad and I getting our vaccine doses at, PCHS, which is the Punjabi Community Health Services, the community I belong to. We went to their pop-up clinic. We both got our shots there. And so, me just sharing that, in fact, ended up, I think sometimes I feel that was more impactful than the 2-hour sessions that I would do. But anyways, coming back to the question at hand, I think building science literacy from the ground up is really important. And sometimes we need to go to 3 steps behind before we get to the topic we are at.
Yeah, so I actually really agree with Sabina's point there. I think it's really helpful when you start from the point zero, they know nothing. And that's to that point of maybe starting three steps behind, is that when you're looking to share an information, what do they need to know to be able to even understand the information you're presenting, right? And then start from that point and work your way through those processes, right? And review and do research and then make adjustments, right? There's something to be said about pivoting and being flexible and having the self-reflection to acknowledge when something isn't working and making the adjustments that may be required, right? So I think that's also a really important lesson.
Thank you all so much. We have time for one more question in the panel. How can you measure the effectiveness of your knowledge translation materials or content for behavior change or just to reach your intended goal?
So I can start with that. So I would say measure formally and informally. You want to take stock of the community's behaviors that you're aware of, what your goals are, and all of the things that you need to kind of take into consideration. What are your actions, and what has the discussion shown with the communities, with your colleagues, and what messaging is coming from that? And is there already change happening in the community that you need to take stock of, right? And use that maybe as a catalyst to spread the message even farther. And then again, keep doing iteration after iteration of the work, right? So finding new ways and not doing one kind of blast and then stopping at that. Particularly with the M&O, we have specific questions that we ask ourselves as a team that I have found really helpful when gaining feedback on whether or not there is effectiveness in our materials. So, you know, we look at whether or not people are understanding the materials, whether or not the materials are accessible to them, whether or not they're having an impact on perspective, whether or not they're learning something new, right? Because the new is the important piece there. And, you know, and then we have those qualitative questions, right? Do they feel that they're applying the information? Do they feel that it is, you know, making a difference in the way that they walk through their life, right? And then in the decisions that they're making. So these are questions that we've used often to ask when we're assessing our materials.
Sorry, do we have anyone else who would like to join in on that?
I mean, I think it's a great question. It's actually a topic that I'm going to take on as a program evaluation of unambiguous science for my DR page. So I'm very excited to see what we get out of it. I think, you know, with other groups that I've been part of, I'm also part of the Focus COVID communication. Some of you may be aware it's through the University of Waterloo that then, you know, we started off as like a fringe group, but then we now have funding and it's housed under University of Waterloo's pharmacy department. But with that, again, we did something similar. We sent out surveys whenever we sent something out, whenever we released one of our infographics or pamphlets to see, you know, what people thought of our pamphlets and where we could improve and whether it made them change their decision or change their mind about something. But I think for me personally, the informal evaluations have been so invaluable. And so, you know, something as simple as, for instance, you know, I gave a talk to a community health organization who'd asked me to come on because, you know, despite being a community health organization, under 50% of their staff had been vaccinated. And then, you know, we tracked measurement to see after every time I gave a talk, I gave a series of them. I had some one-on-one consults and it went from under 50% to 90% to almost 100%, right? And so we could track some of that as well. And of course, you know, it's incredible sometimes having a social media platform, even though I look every day in my DMs and I have 200 new DMs on a daily basis, which is so overwhelming. But then every now and then I go through them when I have time and I see all that feedback coming in on people who've shared my materials, convinced someone else using my materials. And all of that is such positive encouragement because I can tell you that this work is not easy, especially when you have a face and a name attached to the work. You are on the receiving end a lot of hatred, a lot of vitriol, a lot of hostility, a lot of death threats. And so it does make you wonder, why do you continue doing it? Especially because I do it on a complete volunteer basis. But it's really nice sometimes to get that informal feedback to see that there are, you know, it is meaningful and it is impactful in people's lives.
Great. Thank you so much, everyone. So we are going to move on to Q&As because we have quite a few questions popping into the chat. So I'm going to start with a question that can be for anyone. What is the best way to get to know your target audience these days? Any best practices to share resources?
I'll just maybe quickly jump in and reiterate what I just mentioned before. We did that with the Focus COVID communications. The surveys were really helpful. We had funding for that. So we were able to send out these surveys. You know, simple SurveyMonkey just to understand, you know, where people are with respect to what information they want, how much information they want, whether it's actually meeting their needs. I think doing a survey like this can be very easy, very quick to do, and does not cost a lot of money either.
I would also recommend doing like in-person consultations, sharing circles, meetings, those types of things. It can be like lunch and learns, those types of things. They don't need to be large or complex, but having that qualitative look at the discussion and getting personal feedback. We've done this, with youth and bringing families together over an activity and asking them some designated questions while you do a craft or play a game. And it could be the same, with seniors, share a meal, have a coffee circle, those types of things. They don't need to be complicated, but having discussions with the target audience group and allowing them to share their direct feedback and knowledge in a really open and safe space can actually give you a lot of data to consider when building materials.
Fantastic. Our next question is for Peter. You mentioned using QR codes to track the reach of materials. Could you expand on that work?
Yeah, so we're still pretty early at doing that with our materials. But essentially what we're doing is so QR codes, if you don't know what those are those funky little black square looking graphics that are on everything now. So we've started just including them in things, pamphlets, printables, things like that. Just one, to connect people back to our website, in part because, we have a lot of resources. Well, we will have more soon. We have a lot now. We're gonna have a lot more soon of resources available through our site. But also just so we can see, if people are, it actually tells us two things I think that are really important. One, who's picking up are people picking up our things, looking at them and inquiring for information. Two, because our population is sort of known, because we're working with older adults, is known as not being tech savvy, which I don't think is true, but that's sort of the thing. It kind of builds up that use case that like, hey, people are actually using technology, because if people are accessing us through the QR codes. But you can get analytics on those codes. You can kind of get some basic information about who's coming, where they're coming from. And then from that, we can then take our website analytics and kind of connect some dots and sort of see, okay, what's useful to people, what's not. It's rough in the sense that, it is rough. Not everyone's going to scan a QR code. Not everyone's going to, but it does give you a general kind of sense of like, okay, this is useful to some people, kind of can get some sense of who those people are. Just as just have more data, right? Having more data is really helpful. As we were just talking about evaluation, right? So any data you can get is going to be helpful in terms of understanding the reach and understanding the population of people that you're trying to approach. So that's kind of how we've been using it. I'm sure there's other ways to do it too, but that's been sort of our our purpose with it. Yeah.
Great, thank you. So this is for everyone. What are some key personal or professional skills that you would recommend to develop if you want to become a more effective knowledge translator or broker?
I think one thing that's really important is that it's a very basic concept, but the idea that being able to see things from different perspectives, right? Because we tend to get very, human beings can be very myopic and very one focused. So to do good knowledge translation, you need to be able to understand, where your information is going, who's receiving it. We've all talked about that today, but certainly being able to kind of shift your perspective, think, okay, what are the ways people are going to interpret what I'm saying? How are they going to take it? What are they going to do with that information? And also, what do I want them to do with it, right? So having that ability to kind of think broadly about what you're doing is really important. And also to recognize that you don't know the things that you don't already know. So there will be, and I actually think, again, go back to Sabina's example, but she, really pointed to that by saying, when she talked about the possible effects, she didn't know for sure, right? And she acknowledged that she didn't know for sure. And I think, the humility in that is really important. I think we don't really talk about humility much in knowledge translation, but I think it's probably a pretty relevant personality trait or skill to have. And you can learn that, you can develop that. So I think that's a couple of things anyway.
Can I also add patience to it? Because it's one of the areas I've had to work on really. I think having a toddler has really helped with the patience aspect too, because it's some applied skills there. But I think patience is so key. And I think I remember in my early days when I would get feedback, I don't know if I'd always take it, the way that it was intended it to be. I maybe would get a lot more defensive about what I was doing and how I was doing it. But I think just having that patience to look at someone else's perspective and see, I'm like, clearly, if it's not, meeting their needs or they're not understanding it, there's something that I should be doing better. It's something I have not yet. And I will tell you, my test audience in the early days was my husband, who has 0 biology degree. He's an electrical engineer, and he's like, biology makes no sense to me. And so he was the perfect person to actually take a look at some of my early days posts, because he would read it and say, I learned nothing, and I think for me, and I think going back to what Peter said, having that humility to realize that, okay, maybe I'm not doing a great job at this, and going back to the drawing board, and trying out different things, I think would be amazing. And he would say, well, your posts are so black and white, there's so much wording there. And I'm like, well, I'm not a graphics designer, like I'm a science communicator, and I think just going back and thinking, well, maybe it doesn't have to be one or the other, and maybe you can actually incorporate some graphics or learn how to do some of these things that you think are not traditionally your expertise or your area. And so, again, I agree, humility, and I also think patience, and I also think being receptive to feedback is really, really good to have.
Perfect. Thank you so much. The next question is for everyone. So how do you consider language and cultural considerations when developing communication materials, especially if you're working with a diverse audience who maybe does not have English as their first language?
So something that we do is we actually work with people from that community, from that culture. We even get like translators from that community that can specify the message that we're trying to make in a way that's meaningful to that community. In my presentation, I talked a lot about adjusting your language and adjusting your communication methods. And this is a really good example of that, is that if you're changing your language literally from English to, let's say, French, or for us, it might be Michif, you get someone who speaks that language to assist you with that process so that the translation actually makes sense and they're talking in a way that people can connect with, right? So that is something that I would definitely suggest in that process.
I'd love to add on to this. I think that, so using my not unambiguous science hat, but using my South Asian Health Network hat, I think that sometimes what can happen is that because you're trying to, get your resources out to the communities, you feel that you might be the best person to do it, and you may actually not be the best person. And I think sometimes there's, again, humility that needs to be incorporated there, and maybe you actually partner with the community, the organization in the community, and do it together. The number of times we've had people come up to us and say, oh, we want to make resources for the South Asian community. And I'm like, well, actually, we're already doing this, and we've had to have a really good grasp of what our community needs. How about instead you work with us and we can do something in collaboration? And that was always a no-go. And I don't know why, to be honest. And instead, what would happen is we would have, someone to say, come to us and say, we got PHAC funding to do this for the South Asian community. And here is the, piece that we want you to share with your community. And then we look at it and, giving one example, there was one post that talked about get vaccinated, to protect your elderly, which we actually did in the South Asian community too, for the South Asian Health Network. And it was actually a picture of my own father in Hindi that said, protect your elders, get vaccinated. So this PHAC funded group came up to us and had their own infographic that was similar, but instead of it saying protect your elders or protect your loved ones, it said protect your acquaintances. That's what it was translated to. And we're like, wait, what? What? And then so it totally missed the mark. And that's because there was no consultation with the groups. And I also have to say something to the effect of translators. I think translators are fantastic, but the level of translators or the level of language used by translators is very often not what is spoken. And so, the one thing we try to do with the South Asian Health Network, and this was actually really difficult, so I'm not suggesting we do this, but is, because of funding, but if you have extra funds, have someone from the community do the actual translation. So we were actually all healthcare providers the South Asian Health Network, the other co-founders were physicians themselves, and I was the fourth co-founder. We did all the translations ourselves in-house. And the reason is because we use language that our community actually understood. So there was, we did get some funding to use external translators. We got the materials back and we're like, we don't understand that. So what is it saying? Even though, we created the English material and we still didn't really understand it. And so then we said, we're just not going to do that. We're going to do all the translations in-house, just because there is such a huge difference in the proper, written type of language versus, what is actually spoken. And I'm like speaking, from the Hindi Punjabi perspective, at least. And I also think that use different mediums, because sometimes you feel you're using that, again, one size fits all, as, Raya mentioned, does not work. Again, with the South Asian community, we barely have, a presence on social media. Instead, what we did is we infiltrated all the WhatsApp groups, the seniors WhatsApp groups, through the temples, through the mandirs, through, our places of worship. We sort of infiltrated a lot of these ethnic radio and TV channels that we knew our community was listening to or watching. We, targeted it using prime TV time, and we blasted some of our information out through these mediums because we knew that they were not on Instagram. We knew that they were actually not on Twitter. And so we had to find out where they were. And again, having that, my father lives with me, and, I was like on top of all the misinformation, because he'll be like, so-and-so auntie from so-and-so place in India sent me this information. Is that true? And it's like completely not true. But it's really nice to actually consult with the communities to see where they're getting the information from, and then make a way to actually infiltrate those exact places, as opposed to asking them to come to where you are.
Awesome. Thank you so much. So the next question is for Raya, but I think everyone could probably jump in if you felt comfortable. So if an individual or organization doesn't have the budget or time to produce films, how can storytelling be integrated into other media?
So that's a great question. I think that there's a wider way of ways that you can integrate kind of that human perspective to your work. So it doesn't have to be a video. It could be through mentorship. It could be through like connecting people, youth to elders, those types of things. It could be through sharing quotes and personal statements on social media or on your website or those types of things. Like, for example, the MNO also participated in all of the vaccine work, and we had, people who used our information to access the vaccine and how it helped them, and, how they utilized it and why they maybe changed their mind or why they went to a specific location or those types of things. And we used their quote, their story with their permission, and just put it with the general information to kind of connect the human experience to the clinical work, right? So combining those two things. I think the important thing to remember is that from our perspective, when we're doing storytelling, is that we're trying to share a human aspect, right? So we're trying to personalize the information and make it more connective rather than data-centered. And so there's any way that you can get that first person perspective is a successful way of storytelling, right? It doesn't need to be in film or, in some convoluted, complicated way.
Does anyone else want to jump in on that question? Okay, perfect. So the next question is for Peter. Peter, can you explain, you had explained that audiences being senior and how you approached this from their lived experience. Example, knowing the symptoms but not diagnosis. Can you elaborate on the used method for healthcare providers? What was their lived experience like in relation to this topic?
Okay. Yeah, no, I think for healthcare providers, when we're talking about clinical audiences, which I gather is the sense of this question, if I'm not misinterpreting it. For healthcare providers, I mean, it's helpful that many of the people who work for us are healthcare providers. So we have worked in this field and have firsthand knowledge of kind of the general sense of what happens and what it's like. I think a big piece is actually it's going to be a bit of a side just for a second, but one of the things we've actually started to integrate into our work a lot is trauma-informed practices, recognizing the experiences that people have and how that affects them, and also using that as a lens to understand the work that we're doing. Because when it comes to clinical audiences, the couple, at least for me, big priorities are we want to make sure that we know that people want to do the best work they can. So we want to make sure they're getting the information to help them do that. We also know that human beings, being the way that we are, generally get stuck in our patterns and don't want to change. I mean, I'm the same. I don't necessarily want to change what I'm doing. But we know that's not the best way to do things. So, when we update guidelines, so we want to come at it not from a perspective of, looking at, okay, people, we know they have the ways they've always done things, but we also know that people have frustrations, right? Part of being in this field is there's a lot of frustration. So with the way things are, the way things work, or things aren't going well. So, always kind of centering that pitch as like, we're going to help you do things better. We're going to help you do things in a way that's going to actually make your life easier. I'm not part of this project, but we are doing some work around the dementia and sort of, the behavioral stuff around dementia. And, for a lot of people who work in that field, like it can be very draining, right? Because you're trying to help people and support people, but, they can't respond the way that you want them to necessarily. So part of the pitch is, hey, like we know that this is hard and, we know that it's challenging and we're going to help you do it better. And same with primary care and talking about depression and step care, which I mentioned earlier, is like, this is going to make it easier for you to explain this to people. And it's consequently going to make your job easier, right? Because if you can explain to somebody why you're doing the things you're doing, there's a greater chance they're going to accept it and be okay with it. If I'll give you an example. If I go to my doctor and I say, I've been feeling really sad or really upset, and he's like, well, go home, get some more sleep, exercise, eat better, and then we'll see how you feel in a couple of weeks, right? I might take that as like, oh, he's dismissing my feelings. He's like, oh, just exercise. Like, yeah, obviously, right? But what he's actually potentially doing is explaining it. They're explaining it in, the first step in a step care approach is to do self-help, to do stuff that, try that if you're not at the severe point, right? But if you don't explain it that way, it's really dismissive. This has actually come up in our anxiety work because a lot of people will go to their doctor and say, I've been feeling dizzy, or I've been feeling, my heart's been racing or whatever. And their doctor will be like, well, you might have anxiety. And people will take that as like, oh, he's just dismissing me and saying I have anxiety. I'm not actually sick. So what's this person know? But the way you explain that's really important. So part of the thing we're trying to do, and I think we're getting more and more into that now, is giving clinicians the tools to explain things better, to make those conversations easier, because we know that's one of the biggest challenges that they experience in their day-to-day work. So sort of, again, it's putting yourself in the shoes of the person and saying like, hey, what do they actually need, right? Like, I don't need to tell a family doctor that CBT is good for depression. Like, they probably know that already, I hope. So what do I need to tell them? I need to tell them how to explain that to somebody, right? I need to tell them how to like pass that information on. So that's, I think, part of how we do that.
Excellent. Thank you so much. Sabina, the next question is for you. I heard you say that there was some backlash on your social media platform regarding some of your posts. How did you deal with that? I think the question is more, how did you respond to that, or did you?
So I think for me, one thing that I do value is having dialogue and having discussions. So not everyone agrees, and that's okay. I think that's why I actually, while I have the platform that reaches a lot of people, I still value that one-on-one discussions, because a lot of times minds are changed with that. And it's never one discussion. It's usually, multiple discussions where you actually get to a point where someone sees it from a different perspective. So that dialogue, I always like to keep open. And so if someone actually says, well, I disagree with this, and these are my thoughts, I welcome that and welcome having a discussion on it. I don't, however, tolerate any hostility. And so if I know that the conversation is getting to a point where it's not respectful, I don't usually block right away. I usually, on Instagram, there's a mode where you can restrict comments. So I restrict comments there. I mute conversations. I mute people, and it takes a lot for me to block someone. I mean, if someone is completely outright, saying things that are absolutely vile, they get an insta ban, insta block. But otherwise, I try and have that conversations going. I think that a lot of the ones that I was referring to, those are never done in public. They're always coming to you as DMs, because frankly, I think people they're hiding behind the anonymity. And so that's what makes them very bold to send some of these, death threats and really, really vile messages. Those are never public. Those are always private. And I've had to protect myself through many ways. In fact, the one great thing about having a techie husband is that he helped me on that. Where if you go to my page, or, to send me an email, you have to verify your email address. And I went from receiving multiple death threats a day to, once every couple of weeks, just because you actually had to confirm, your email address. So I use those mechanisms. I for a brief period of time, unfortunately, some of my posts were shared by Donald Trump Jr., and that ended up in like a month of possibly some of the worst attacks of my life. And so during that period, I enlisted people who actually went through my inboxes and cleared all these messages, because it just was not helpful for me to read some of that. It did make me second guess as to whether putting my family's safety at risk was worth it, etc. So, I mean, those are all the very extreme situations that you have to protect yourself against. But if it's just this disagreement, or, someone who doesn't agree with what you're posting, I welcome the dialogue. And sometimes even academics, we don't always agree. I mean, I think, I can say that now that I'm doing my second graduate degree, I have the ability to say this, but if you put, 10 academics in a room, you will get 15 opinions, right? And so that's just and that discourse is actually really important, because that's how you build consensus. So I welcome that. That I have absolutely zero issues with, as long as you're having a respectful dialogue. I'm like very open to it.
Great, thank you. So we have time for one more question, and this is for anyone. Can you share any experiences that you have had using a champion to move a message forward?
So the MNO actually does this all the time. You would have seen in my presentation, we actually had one of the videos called Champions of Change. And this is where we use people who have had the direct experience, or who have the direct knowledge to speak to others. Often we find it really beneficial to connect, youth to elders, or, even new employees to senior employees, or, using experience as a way to be champions, right? And so we found that really beneficial. I'm just looking to see the question was removed. Okay. So we have found that really beneficial, but I would say that for us, champions are someone who has the skill to communicate effectively, the skill to break down information, and then the humility to share without pride, and then the willingness to work with others, right? So to connect. And we have done this a lot on Zoom, in one-to-one interactions or in group interactions. We've really benefited from using the Zoom platform or social media to have those conversations occur. And that has been really successful for us.
Yeah, we've definitely done this on the clinical side. So, we enlist experts, and they are experts, but expert is such a loaded word now. But we certainly enlist, we have great geriatric psychiatrists and people who really know what they're talking about, and we create opportunities for them to, whether it's through webinar. Something before I actually was working at CCMH that they did was they had a partnership with Shoppers Drug Mart, and had one of our geriatric psychiatrists do webinars for pharmacists to teach them about prescribing guidelines for depression, and just leveraging those kind of opportunities. We're lucky to have those connections because we do clinical guidelines. We get connected to the people who know, and we just create opportunities. So on the clinical side, it's been really great. We've actually been exploring doing it more on the public side, and finding And wanting, it's also like the flip side of that. I think Raya kind of got at this too, is like when you use sort of champions, you use people, you're engaging that lived experience that those people have, right? So they're giving you that element that you can't just get from a paper or from, a systematic review. They're giving you that lived experience, and that's so valuable and connects to people in such a better way than just saying like, yes, here's what the research says, right? Because people don't necessarily buy into that as much as they do to hear someone say like, this has been my experience, and you should listen to these people because their experience aligns with my experience and it makes sense. So yeah.
I completely agree with what both Peter and Raya said. I think for us, what we've done is we've really engaged with our community ambassadors. I think that they've played such a huge role. And we've had, sessions where we did joint education sessions, where we had sessions that were specific only for the community ambassadors, who then, brought their toughest questions that they were getting from the community. And we sort of, brainstormed on how to address them so that they could go back and continue working and leveraging those relationships with their community. We also, went to see who people were actually getting some of their information from. So for instance, when we did some of our pop-up clinics for the vaccines, we had physicians from our own community there answering questions in a South Asian language. We engaged with a lot of the pundits, who had temples and mandirs. And actually, they were the ones who were then going out and giving some of this information to the community. And so I think that there's so much power within the community, and I think we haven't fully harnessed the power that exists within communities. So I think, for me, if anyone's ever looking to, brainstorming on how to engage a champion, go to your community, because again, so much power within them.
Excellent. Well, it's getting close to 1, so I think we're going to have to wrap up the session for today. I really want to thank our panelists. Thank you for your presentations and your really thoughtful commentary. And I want to thank our participants for joining us today. I hope you enjoyed the first session in our webinar series. Your feedback is really valuable, so we are going to post an evaluation in the chat. You will also receive it via email after. And we hope that you can join our next session. It's next week, March 18th, and that is on intersectoral collaboration. You can find the link in all of our social media, and please follow us so you can stay connected with any of the webinar events or information that we share. If you have any questions about today or about our upcoming webinars, please feel free to reach out to the team. But otherwise, have a really lovely day. We'll see you next week.